Now, the other classification which we observed in adrenergic beta blocker was beta blocker with intrinsic sympathomimetic activity. Example like indolol or azibutolol. So, what does it mean? Because these drugs can activate beta 1 or adrenergic beta receptors submaximally. That means the receptors are not being allowed to blocked completely or not being allowed to be activated excessively. So that will maintain the patency of the receptor in the normal level. So that's the advantage of a drug or a beta blocker with intrinsic sympathomimetic activity. It blocks but not a complete blockade. It shows sympathomimetic activity but only a submaximal activity and prevents the excessive activation of beta adrenergic receptors. So they give some advantages over other beta blockers, especially over non-selective beta blockers, like there will be less chances of bradycardia or cardiac depression, especially in elderly patients or geriatric patients. There will be no rebound hypertension. The non-selective beta blocker, propranolol, the main disadvantage, if the drug is withdrawn suddenly, if the drug is missed, there is a risk of sudden rebound hypertension. And if the non-selective beta blocker is used for angina pectoris, if the drug is missed or if it is withdrawn suddenly due to any other cause, there is chances of sudden attack of angina. So those two side effects will be nullified in case of beta blocker with intrinsic sympathomimetic activity, and they have least effect on plasma, carbohydrate and lipid profile, but they are not useful in, that's a disadvantage, not useful in migraine prophylaxis because they promote the vasodilatation of cerebral blood vessels compared to other beta blocker, that is non-selective beta blocker, and they are also not suitable for secondary prophylaxis of MI.